Talks. I am Dr. Sandeep Patel, founder and CEO at Docthub. Today our topic is opportunities in occupational health for doctors and nurses. Our guest is Dr. Divyang Doshi. He is a Chief Medical Officer at Godrej Industries from Mumbai, and we'll discuss with him what was his journey and what could be the opportunities for doctors and nurses in occupational health. So welcome you, sir.
Thank you, Dr. Sandeep.
Let's start our discussion with tell us about your professional journey. What was your study, which course you have done, and then your professional experience in different industries and how you put it.
So, see, Dr. Sandeep, it has started in 2009 when I completed my internship. And after internship, like all MBBS students do, I was also searching for a job and preparing for my post-graduation examination. Meanwhile, I got an opportunity in SR Oil. That was my first industrial job. And that time I was completely unaware how industry works, how things are going on. So I just went there and I joined the job. And meanwhile, I started by reading for the post-graduation. During this job, I realized a lot of things about the industry and about how it works, how it functions. And then I decided to move towards the occupational health. After that, it was a difficult decision, but I decided to move towards occupational health. And after that, I did the first step, that was a certificate in industrial health.
Yeah.
I did it from Vadodara. And after that, during my course of employment, I have completed many courses.
So, I'm sorry, Vadodara, that institute is MS University.
MS University.
And they run this distance learning course, CIH, Certificate in Industrial Health.
It's certificate in industrial health.
So, I think 6 months of course?
Correct. It's a 6 month of course, and they take the contact lecture on each Sunday.
Yeah.
And it's followed by a practical and theory examination.
Okay.
So after CIH, I got a good position in SR, and from SR I went to Tata Chemicals. From Tata Chemicals, I have worked with Wellspan and currently with Godrej. Through my professional journey, I have also completed this diploma in industrial hygiene. It's a different course, not exactly for the doctors or occupational medicine, but it will help. It helped me a lot in understanding the exposure and in understanding noise and all other things.
Okay. So where did you do this diploma course?
This course I did from Annamala University.
Okay.
And it's a 1-year course, again a distance course. And during this course, we visited a lot of industries.
Okay.
There was a contact lecture for 1 month. And after that, I have completed my diploma, industrial hygiene. Post that, I feel there is a requirement to have a trained in basic life support, advanced cardiac life support, and advanced trauma life support. So I did that courses. I think a lot of institutes offer those courses.
Yeah.
And after that, I got an opportunity to pursue my course, Occupational Medicine Specialist in London.
Okay.
Then I went to...
What was the institute?
that institute was Faculty of Occupational Medicine London.
Okay.
And see how it works. They ask for your portfolio.
Okay.
That includes your experience and all other things. With your portfolio, if you apply for that course, they will offer... few university will choose you.
Okay. Yeah.
So it is basically there in University of Birmingham, University of Manchester,
Yeah.
Glasgow, and then Faculty of Occupational Medicine, London. So I got my admission in University of Birmingham.
Okay.
So they have their occupational medicine department. There was a contact lecture for a month, and it was a very good experience. We went there, we visited a lot of industry. One of the industry was Jaguar Land Rover, where I visited the industry, their occupation health center, and all other things. And after that, there was exam. That includes this practical and again theory examination and your portfolio examination. So in 2018, I have completed the diploma in occupational medicine. After that, during my journey through Wellspan, I realized there is a lot of administration, health administration requirement is there, and that time I pursued this certificate course from IIM Kozhikode.
Okay.
So that's healthcare management and analytics. and currently now I'm working with the Godrej Industries. So here my job profile is basically as a Chief Medical Officer for Godrej Industries and associated company. We have around 85 locations across India, some location in Bangladesh and Indonesia. So I'm taking care of their occupational health as well as the preventive health.
Okay, so entire the employees and all the team working in different locations. That different locations also they have a OHC setup, and then the team. Your role is to ensure their employees' health and preventive measures and all. So that's great. A very good your career path, and I hope the viewers will get the inspiration for the people who are looking for occupational health opportunities. So, how did you came across occupational health profession? I mean, if today an MBBS doctor want to decide for occupational medicine as a profession, what confusion he should resolve, or what dilemma, and how to choose? Before choosing, we know there are so many questions or confusion. So to make that clarity, what will you advise to the MBBS doctors?
See, like as per my experience, as I said, in 2009 during my first job, I chose to go for occupational health. It was not an easy decision because that time there were so many options around me. One to take the PG, one to go abroad, and one to choose for MBBS. And that time people perceive MBBS occupational health as a plain MBBS doctor, and the future about occupation health, the how we can make our journey career in occupational health is still unknown. So of course for MBBS doctor it is a tough decision. But what I would suggest to those doctors, like if you are interested to make do something different, if you want to touch upon the larger people base, larger population base, because when a physician touch one patient, that is a one patient that get cured. But if occupation health physician make one decision, that will affect the entire employee base of a company.
Okay.
So it's kind of a like preventive health or a larger mass health, I can say. So if you want to pursue your career in that direction, definitely you should go for occupation health. One more thing I would like to highlight, that is in occupation health we can say there are two eras. One is pre-pandemic and one is post-pandemic.
Yes.
So pre-pandemic, the occupational health physician or a factory medical officer was limited to only occupation health center, wherein he was just doing pre-employment medical checkup and legal compliances. After pandemic, the industries has realized the importance of preventive and occupational health. And now the doctor who were sitting in an occupational health center, now he got a chance to sit in the boardroom and advise the industry how to go ahead with the business. So the role is now very broad, very diverse role. So of course, if you want to pursue your career in a preventive health, you should go for occupational health.
So there are another aspect of professional work. It has been expanded after pandemic. So that's a very good aspect. So you get an opportunity to interact with companies, board members, the management, and you doing analysis and presentation, explaining the impact of preventive health of the employees to overall company's outcome and other things. So that's a very good, if people want to feel like that part of work, they can definitely choose occupational health. So next question is, what is a role of factory medical officer?
Yes, I'll talk about the present role, the post-pandemic role. So if you want to divide in a broad verticals of a factory medical officer, one is of course that is a legal compliance. That is must. That includes pre-employment, periodic medical checkup, analysis of the factory
under
data.
A country's act. There is a mandate. Factories Act. Factories Act. Under this Factories Act, there is a mandatory of FMO, Factory Medical Officer, at OHC, Occupational Health Center. There is a mandatory norms and all.
A factory employing more than 500 workers, formally or informally, they have to deploy a factory medical officer in their factory.
Full-time
Factory medical officer. And then every 1,000 employees, they have to add one more doctor. So
Okay.
that's a legal requirement.
Okay.
So in that way, factory medical officer is a legal post.
Yes.
But that is a very little aspect of his job.
Okay.
That's a legal compliance. Apart from legal compliance, the factory medical officer is expected to do a lot of other activities in preventive health.
Okay.
Like, see, one thing is to diagnose the disease and treat them.
Yes.
Second is to prevention of the disease.
Okay.
So factory medical officer has a vital role to keeping the
Okay,
manpower healthy.
So
and
that
more
means
productive.
he will be identifying the occupational hazards might be developed among the employees and to work for the preventive aspect of that hazards to minimize it in a employee's health.
Correct.
So they also plan for the preventive health programs, different programs like
Yes.
diabetes and for the chest prevention, kind
Hearing
of respiratory,
conservation, yeah, a lot of
hearing,
other programs, yes.
hearing improvement and all. So okay, so that is the aspect. And what kind of role of audits? I mean, I think in a legally
Yes.
there are certain audits also FMO
Of
do.
course, yes. FMO has to face a lot of audits. Basically, that's a legal compliance audit. Apart from that, industries generally go for a lot of other compliance. That's ISO compliance.
Okay, yeah.
And other like BSc, British Safety Standard compliances. Generally, factory medical officer closely work with the safety department.
Okay, so
Because it's
they might be a
EHS,
part
yeah.
of safety audit,
Correct.
health and safety audit
Yeah.
maybe.
So
And also I think one of the role of training aspect. I mean any first aid training
Yes.
to the employees, like is in case of any incident, how to do first aid or the immediate response to any kind of medical emergency. The basics to the employees, they also train the
Correct.
employees, right?
factory medical
Okay.
officer only involved in first aid training, BLS training to the
Okay.
employees and
Good.
workers. Yes.
So I think next question, what is OHC and setup and its work? We have already, I think, in this question we have some of the part we have
Right.
already discussed. Just to any few points if
Yeah.
you want to add the OHC
I
setup.
would- As I said, the OHC or a factory medical officer is broadly is a part of EHS team, that is Environment, Health and Safety team.
Okay, okay.
So factory medical officer, of course, it closely work with occupational health nurse. Apart from that, he generally works with the industrial hygienist and
Okay.
ergonomist.
Okay.
So ergonomist is again a new branch, but it is very developing here in India.
Okay.
But these are basically the verticals in OHC.
Okay, okay. So next question is occupational health courses for doctors. What all are in India, and how to pursue, and what's the admission criteria? If you can give us.
Yes,
maybe.
absolutely. See, occupational health courses for the doctor. See, first and foremost is the legal compliance. So, as mentioned in the Factories Act, you need to do either CIH or AFIH. CIH is Certificate in Industrial Health, and AFIH is Associate Faculty in Industrial Health.
Yes.
So, this list of the courses is every time it is released by Central Labour Institute, and CIH is something which is a little different course that is there in MS University. You need to have at least 1 year of experience in the industry to pursue this course.
So initially they can join as a medical officer in a particular factory, OHC, and meanwhile after completing a 1 year they can also pursue, because these all courses are distance learning or with 6 months or 3 months. I think AFIH is a 3 months of course.
Yes.
All the courses are listed on our courses portal on docthub.com. courses.docthub.com. You can choose the specialty in a filter occupational medicine, and then you can if anyone want to get the details, they can search on docthub.com. So next question is, what is a role of occupational health nurse, and if a particular nursing staff or nursing professionals they want to go further to job in OHC, what will you advise to them?
See, occupation health nurse has an equal importance role as a factory medical officer in any industries. So, the role of the occupation health nurse is basically to measure all the occupational parameters like audiometry,
Yeah.
PFT, analysis of that data, and give it to FMO so FMO can make the insights out of it.
Okay.
So occupation health nurse, generally they are also involved in the training of the employee, the BLS training,
Yeah.
first aid related compliances. In some OHC, they are also a part of a employee assistance program or a counseling program.
Okay.
So in that way, even occupational health nurse has a very broad
Okay.
things to do there in the industry.
So they are working with the doctors
Parallel,
parallelly.
Yes.
And their role is also an important part. Okay, so that's good. And now the most important queries and among the viewers, that what is the earning opportunity for doctors and nurses in OHC or occupational health overall for the doctors and nurses? What kind of salary, starting and then after a few years of experience? And also we would like to know what kind of designation for the doctors, the hierarchy and the future when they start as a FMO or only a medical officer and then reach to the different levels.
See, earning opportunity for the doctor. If a doctor is good, the sky is limit. That's a one sentence answer. But if you see in an industry, of course, it is better than any other part, like a primary health center, a government setup, or a kind of working as a RMO in a hospital. Industry will pay you better than this.
Okay.
Generally, it starts with factory medical officer to some industries has zonal heads and then to chief medical officer. And of course, chief medical officer is not up to the limit. There are some industries who are having Asia head or global medical directors as well.
Yes.
So yes, in industry, of course, if you are good, your attitude is positive. This for earning, the sky is the limit.
Okay.
Yeah.
So, in current scenario, what is the factory medical officer's starting salary? I mean, if a fresher MBBS is going to join as a medical officer, and after that, if he completes CIH course, then what will be the salary range from? If you can just a reference range,
if we see the current market scenario, of course, MBBS doctor, just fresher without any CIH or AFIH can get a starting salary from 80,000 to 1 lakh a month.
Okay.
And once he complete his CIH, that time he is also having the 1 year of experience in the industry. So it ranges somewhere around like 1.3 to 1.5 lakhs.
Okay.
It's a general
yes.
salary.
But again, definitely it will depends on the factory, the industry, which industry, and the location to location. It will differ, but
Correct.
overall, it's a very good salary range. And now for the nurses.
Yes, of course. For the nurses, it generally start for those who are GNM without any training in occupational health. It starts with 20,000-25,000 a month.
Okay.
Sometimes, like in a good industry, is 30 to 35,000. But once you are trained in occupational health, I think we forgot to discuss the courses about the nurses.
Yes.
So see, Central Labour Institute, they offer a 10 to 15 days training program in occupational health. That's I guess in Mumbai and Delhi. And of course, the IOH Baroda branch, they also offer, they have designed a very beautiful course for occupational health nurses, wherein they teach everything like that's audiometry, PFT.
So what is this IOH?
IAOH is Indian Association of Occupational Health.
So they also run the
Such
training
courses,
programs
yes.
for the nurses. So that's if any nursing professionals they want to pursue occupational health, it's a very good opportunity.
Of course, it's a,
Yes, yeah.
it will be a great opportunity. Yes.
So that's all for this doctor talks, and I hope that you get all your queries regarding occupational health, and more courses you can definitely for the doctors and for the nurses. Occupational health nurse also can related to occupational health courses like training courses or certificate courses. Also, they can search on docthub.com under the courses section, you will get the details of different institutes they are offering the courses. Thank you very much.
Thank you.
Very much,
Thank
Dr.
you.
Divyang, for having with us and enlightening your experience of occupational health. I hope that the more professionals will come to this. I would say the occupational health is in a very developing phase, and after pandemic, it is definitely going to in a quickly in a rising phase. We will see the trend in a healthcare industry definitely.
Right.
So thank
Thank
you
you.
very much, viewers. Thank you.